Hello, everyone. Thanks for joining us today. I see some additional folks have come in the room since I last came on as well. I think we'll go ahead and get started. So this is the fourth webinar in a series on use of complexity-aware methods in evaluation and research. I'm Jessica Farringer, Associate Director of Data for Impact, and I've got two colleagues joining today, Emily Weaver and Catherine Andronopoulos. Dr. Weaver is a research associate for the Data for Impact project based at the Carolina Population Center at University of North Carolina, Chapel Hill. She's worked for about 14 years in research and evaluation of public health programs with expertise in maternal, newborn, and child health. And Dr. Andronopoulos is a senior researcher with measure evaluation and an associate professor in the Global Community Health and Behavioral Sciences Department at Tulane School of Public Health and Tropical Medicine. She conducts applied research in the areas of gender, HIV, and key populations. So for our agenda, we will start today with just the brief introduction that I am giving, and then Dr. Weaver and Dr. Andronopoulos will share case studies of work that they've done in Botswana and Uganda using organizational network analysis, or ONA, as you will hear us refer to it. And following these case studies, we'll have a period for questions and answers, so please save your questions till the end, and also please put your questions into the Q&A section. Hello, I'm sorry. I think there was an issue with my microphone being muted.
You muted right after your first comment, Jessica.
Oh, geez. I'm sorry, everyone. Okay, well, you probably saw the agenda slide. So I'm going to go through just an introduction to organizational network analysis, and then Dr. Andronopoulos and Emily Weaver are going to present case studies on work that they've done using ONA in Botswana and Uganda. And then we're going to have questions at the end. So please save your questions till the end, and there is a Q&A box that you can type your questions into. So organizational network analysis is similar to social network analysis, but the difference is that the actors in the network are organizations instead of individuals. And similar to social network analysis, one of the advantages of ONA is the power to visualize relationships between these organizations. ONA is a data-driven approach that helps us to understand group dynamics, patterns of relationships, and the structures of groups. We can see which organizations have more or fewer connections, which are central hubs, and which service gaps need to be filled. The basic method involves surveying all organizations in a defined network. And next, I'll briefly outline 8 steps that are key for using ONA. So first is to engage your stakeholders. Throughout the planning, implementation, analysis, and communication, you should work with those who have an interest in the performance of the network. And this is an ongoing process, not just for the beginning of the work. Then you need to define the network. You need to apply specific criteria to define your network. The network is basically a cluster of organizations, so government entities, non-governmental organizations, community-based organizations, and others providing the services of interest within your geographic area of interest. Then you need to enumerate your network members. You generate an initial list of all network members in the area of interest by identifying community gatekeepers and interviewing them to build a list of all service providers within the network. So this is your enumeration period. Next, you interview organization representatives, conduct interviews with individuals representing each network member or organization, and you're looking for their input into network members, the quality and quantity of interactions between network members, and their perspective on why connections do or do not exist. Next is to interview clients, potentially. You collect information directly from clients through client interviews to understand their perceived quality of care, their met or unmet needs, and some of their behaviors, depending on the study topic. Then you map the organization locations. You collect geographic coordinates of the organizational network members, as well as important landmarks, points of interest, and transportation hubs. This information will be useful to visualize the network members, their location in relation to others, and can help to illuminate any access barriers. Next is to analyze the data. So you analyze the data collected using quantitative and potentially also qualitative methods. You can use a network analysis software such as UCINet or Gephi. You analyze the relevant data by utilizing measures of centrality, density, and reciprocity of network ties. And our speakers, when they're going through their case studies, will discuss some of these measures further to define them for you. You can also use qualitative software to analyze any interview transcripts that you may have developed. And then the last step, of course, is to share the findings with organizations. So conduct a dissemination meeting so the participating organizations have an opportunity to see the network they're a part of, validate the quantitative data, discuss how to improve the network and linkages, and understand how improving the network will benefit them. So these 8 steps are just a general guide. Obviously, different studies implement O&A differently, and I think even when we hear the 2 case studies we have, they may have implemented their study differently, but this was just to give you a basic idea of how it can be done. So then with that, I will turn things over to my colleague, Emily Weaver. So Dr. Weaver is a research associate with Data for Impact at the Carolina Population Center at University of North Carolina. And she's worked in research and evaluation for about 14 years with a focus on maternal, newborn, and child health. So Emily, with that, if you could share your screen, that would be great.
Thanks, Jessica. Hi, everyone. So this case study is about an organizational network analysis that was conducted to better understand referral networks for adolescent girls and young women, or AGYW, in 2 districts in Botswana. Adolescent girls and young women are an at-risk group for health and other health issues. They frequently require services that are not available in one health facility or service site. And this creates a need for referrals between facilities or service sites. Therefore, the DREAMS program in Botswana was established to serve the needs of at-risk AGYW with a focus on providing effective referrals. Safe spaces is a concept that was established to serve as a hub for referrals for these AGYW. Girls in schools and communities are screened for at-risk behavior or circumstances and then enrolled in safe spaces, which are groups of AGYW who are led by a mentor. This mentor may identify a need and refer an AGYW for services, for example, for HIV testing services, family planning, or in some cases, post-gender-based violence services. The types of services provided by the DREAMS program are both clinical and non-clinical, and as you can imagine, not all provided in one location. The DREAMS program planned, after the completion of this assessment, to integrate youth-friendly service facilities into the program, and the facilities would be the main points of referral for the AGYW. So therefore, the purpose of this study was to conduct the organizational network analysis to understand current referral networks for at-risk AGYW in the DREAMS program areas. And we did this through mapping existing referral networks using ONA and by conducting qualitative research with AGYW about their preferences for services. But we won't be discussing this second qualitative part of the study today. We adapted a previously piloted and tested ONA survey instrument that contained 3 modules. The organizational attributes section or module had questions on the name and location of service sites, the number and type of in and out referrals, number and type of workforce within the facility, and types of services offered and referrals made, among others. The service linkages section had questions on type of service site and nature of collaboration with other service sites in the 2 districts for DREAMS-related services. The program interaction section includes questions on the quality of interactions between the service site and its linkages with other services. The survey included structured, closed, and a few open-ended questions. D4I and our local partner Premier led 3 days of data collection training on the ONA survey for 5 survey enumerators and 1 supervisor. These training days included topics of ethics, the survey instrument, and paper-based data collection. We introduced the study and provided an overview of the survey, treatment on human subjects, interview techniques, which included initiating contact with the service provider, obtaining informed consent, conducting the survey, and returning to facilities that require callbacks, as well as an in-depth review of the survey instrument in both English and Setswana. Enumerator and supervisor manuals were reviewed and practice interviews were conducted prior to a pretest. We conducted each service site to arrange an appointment with the person in charge to introduce the study and verbally seek their permission to include their site in the study. We also asked them to designate an interviewee with an in-depth knowledge of the internal characteristics of the organization and DREAMS services it offers. We then approached the designated interviewee, asked for their written informed consent, and request an appointment date and time. We asked them additionally to extract data on DREAMS services provided, referrals made, and organizational characteristics from reports and records before the interview appointment. If the interview was not successful after the 3rd attempt, we considered that a non-response. These data were collected on paper survey forms. A member of the UNC survey team accompanied the Premier team for the first few days to ensure that the protocol was being appropriately followed and to ensure quality of survey implementation. We conducted the descriptive analysis of the survey data using Stata software to generate summary information about characteristics of survey sites. The ONA analysis itself was conducted using R. R is a free software with several packages that can be used to generate network visualization graphics and to calculate network properties. The reason for selecting R for this, this activity was really more pragmatic than anything else. R was free. Our university provided support for the use of R, and it also has a number of packages that can be used to help with the ONA visualization. This slide shows a screenshot of the ONA matrix in the data collection form where we asked, We would like to request that you list all facilities, organizations, and offices in your district that you believe are involved in some way in the provision of care and support for AGYW ages 10 to 24. And from that matrix, we get the following summary information. There were 67 potential service sites identified, but they were not all interacting much with each other. The most common types of linkages or ties these organizations have with each other are sending clients, you see 1 to 3 times per month, and information, which was also 1 to 3 times per month. The ONA software creates depictions called sociograms that show degrees or connections between organizations. In this sociogram, the safe spaces are colored in blue and their potential out-degree connections are colored in orange. By potential out-degree ties, what I mean is that organizations that a safe space knows about as providing a DREAMS-related service, such as HIV testing, but has not necessarily referred to. This sociogram presents the potential for the network of safe spaces. This type of potential network, meaning the type of services provided at the potential referral site, is shown in the color of the line and arrow. Each line indicates an information link between 2 service sites. Arrows represent the direction of the relationship. The main takeaway from this sociogram is that each safe space has several other potential referral sites to which they can refer the AGYW when needed. So this is the potential for referrals. This sociogram shows the actual ties or referrals occurring between organizations. Again, the safe spaces are depicted in blue with numbering corresponding to their unique ID in the survey. The types of referrals being made are reflected in the color of the arrows. There are a few out-degree ties in this sociogram, but it actually reflects 237 total ties or referrals being made. 70 were for HIV, which are the orange arrows, 26 for gender-based violence-related services, which are the green arrows, and 141 for HIV and contraceptive services, which are in blue. So the potential network of out-degree connections for youth-friendly service facilities is also fairly large, which is shown here in this sociogram, with some overlap, which is shown in the middle of the sociogram. However, the actual out-degree ties for youth-friendly service facilities is limited to just 3 organizations shown here in orange. The yellow arrows reflect a total of 250 referrals for HIV testing services. The green arrows reflect 6 referrals for gender-based violence-related services, and the blue arrows reflect 1 referral for pre-exposure prophylaxis, or PrEP. Nothing about this sociogram reflects the volume of referrals between degrees or organizations. It does not reflect the volume of referrals, but R does have this capability. So you could potentially adjust the width of the lines in the sociogram to show the relative volume of ties or referrals occurring. Aside from referral volume, we also wanted to be able to identify gaps in service provision and referrals for AGYW. We did this by asking the questions shown here. Is this service available from your organization, facility, or office? Do you or your organization, facility, or office currently provide referrals for this service? And for these 2 questions, we defined a gap as a service for which 1, the service is not available, and 2, referrals are not provided for the service. Here we can see that there are several gaps, which are represented by the dark circles, for which services are being neither provided or referred for, notably for PrEP services and HIV post-test counseling. When we look at gaps for family planning services at youth-friendly service facilities, the bottom panel of this table, we find additional gaps for injectable contraceptives and female sterilization. This is a good place to note that we may not expect AGYW to need or want female sterilization, so gaps in the service area may be less concerning or relevant. Other post-gender-based violence service gaps exist at youth-friendly service facilities for non-clinical services such as child protective services, economic empowerment, and legal counsel. Again, these are services that one may not anticipate a youth-friendly service facility to provide, but the availability of referrals for these services could be important. So in sum, we identified 69 potential service or referral sites that in the DREAMS network, but the referral sites are in large part not being used. For youth-friendly service facilities in particular, gaps exist in terms of certain types of contraceptives, PrEP, and post-GBV services. We learned a lot from doing this study, and one thing that was challenging in terms of designing the study was defining a specific network for the study. Given resource constraints, we were unable to survey all service sites in the 2 DREAMS districts, as we may have liked. So we had to find a way to narrow the scope of the survey. And we did this by limiting those sites to sites surveyed to youth-friendly service facilities and safe spaces for the analysis. Second is the importance of considering context for the design and analysis. Some of the youth-friendly service facilities, for example, provided all targeted clinical services. So in the end, it may not have been concerning for those facilities not to be providing referrals for clinical services. Also, given the target population of DREAMS, who are AGYW, not all service types with targeted services, specifically family planning, may be applicable. The example I am referencing is that of female sterilization, not being available in some facilities. However, in terms of implementation, we found the tool to be straightforward and easy to train on and implement. Finally, the lack of referral documentation in some youth-friendly service facilities was a challenge, and we knew this would be a challenge going in. This is especially because we could not collect information for referrals for which documentation did not exist. This is likely to be true in many developing country settings, and understanding of the extent of documentation related to your outcome is important before implementing your ONA. So with that, I'll hand the screen over to Catherine, who will present on her organizational network analysis.
Okay. Hello, everyone. Thank you, Jessica, for the introduction, and Emily for the interesting presentation about network analysis in DREAMS in Botswana. In the remainder of this presentation, I will present our use of organizational network analysis as part of the evaluation of the local capacity initiative in Uganda that was conducted under Measure Evaluation. I'm based at Tulane School of Public Health, and I worked on this project with Mary Frater, Tori Taylor, and Annie Glover, who are also at Tulane. In Uganda, the evaluation was implemented by Crestals with leadership from Frederick Mayanja, Heath Namisango, and Simon Wand. From here onward, I'll refer to the Local Capacity Initiative as LCI and civil society organizations as CSOs. And just very quickly, I want to make sure that everyone can hear, okay? Before I proceed, just check the chat. Yes, okay, thank you. Okay, so the purpose of LCI was to strengthen the capacity of CSOs to conduct policy advocacy that would improve health services for key populations affected by the HIV epidemic. PEPFAR funded the initiative from 2013 through 2018 in 14 countries to help local CSOs create an enabling environment for PEPFAR's objectives. In many of these countries, LCI included capacity building that was structured to build coalitions that could support long-term policy advocacy for key populations. Given the complexity of capacity building and policy advocacy interventions, the main goal of the LCI evaluation was to describe the potential mechanisms by which LCI investments might improve quality HIV services for key populations, not just whether a change occurred. The evaluation included a systematic review of the 14-country projects, a multi-year analysis of the project in Uganda, and an end-line evaluation of the project in Ghana. Today, I'll focus just on Uganda. In Uganda, our evaluation focused on three main areas. First, what changes occurred in the capacity of CSOs to conduct policy advocacy. Second, what changes occurred in public officials' attitudes toward female sex workers and men who have sex with men as a result of policy advocacy and LCI activities. And third, what changes in quality HIV services for female sex workers and MSM occurred at clinics working with LCI. The network analysis that I'll talk about today was embedded in the first question related to CSO capacity strengthening. More specifically, we wanted to know whether between the intervention period of 2017 and 2018, if there were changes in the level of connectedness among the CSOs participating in the capacity building, mentorship, and other LCI activities, and whether there were changes in which organizations were most central within the coalition. By focusing on the coalition as a unit of analysis, we moved away from considering only LCI effects on individuals who participated in trainings or single organizations to a focus on a network of organizations. The hypothesis under study is that the structure of the coalition should get stronger as the organizations participate in activities to build a unifying structure to confront policy challenges. This is based on the assumption that synergies across organizations will increase power for effective policy advocacy so that the whole is greater than the sum of its parts in confronting policy issues. It is important to stress that our network study of the LCI coalition in Uganda was one piece of a larger puzzle that made up the LCI evaluation. It was extraordinarily valuable to have this network data triangulated with other descriptive characteristics about the participating organizations, individual CSO workers within the organizations, public officials through surveys, and qualitative work that included the most significant change approach. There were 18 organizations that participate in the LCI coalition. In 2017, organizations reported on 19 other organizations, and in 2018, they reported on 18. For this analysis, we limited this number to only organizations participating in LCI. There were 3 lead organizations receiving financial support to run LCI activities. We excluded them from our network analysis so we could observe how the coalition changed, looking only at recipients of the training, mentorship, and other activities rather than those also implementing the activities. In terms of overall connectedness of the coalition, we calculated the proportion of connections between organizations in LCI out of all the possible connections that could occur. This is called network density. We also examined how positions of organizations within the network might change during the intervention. So for each of the 16 organizations in the network, we calculated how many other organizations they were connected to in 2017 compared to 2018. This is called degree. We also looked at their betweenness, meaning which organizations were most likely to form bridges or links to other organizations in the coalition. We collected data for the network analysis by interviewing a representative from each organization in LCI, typically the executive director. The network module was just one part of a survey about the organization and contained about 12 questions. A major take-home message from this work is that the level of data collection skills and training of the interviewer that is needed is on par with that of a typical survey administration. It is only later in the data analysis that things become slightly more complex. Here you can see the preamble to the network module of the survey. We created boundaries for the network by being clear about what we meant by the terms worked with, organization, and that the connection should be related to achieving LCI goals specifically. Next, there were 2 types of questions. The first was a name generator, wherein the participant was asked to name all the organizations their organization worked with in the past 6 months to help achieve LCI goals for female sex workers in MSM. If the person interviewed did not name an LCI organization, they were prompted with a list of LCI organizations by the interviewer. It was important to bound by time so we could compare 2017 and 2018. All subsequent questions asked about forms of exchange for each of the organizations the organization had worked with in the last 6 months. We captured the frequency of exchange, but in the end reduced this to a binary variable of whether organizations were connected or not. We asked about different forms of collaborations or exchange that involved increasing intensity of interaction, as you can see, moving from the left to the right. This is represented by the darkening of color and moving up an incline in this picture. Some of the forms of exchange, like attending a common activity or event, we would expect to happen based on planned LCI activities, like trainings. However, the other forms of interaction are less passive for organizations and capture if organizations began to collaborate apart from specific LCI activities in ways that may create sustainable change and coalition strength for policy advocacy. The data was collected electronically using the ODK platform. Here is where the increased level of research training comes in. The team in Uganda was highly skilled in ODK programming so that they could collect information across organizations named both spontaneously and through prompting. This data was exported as a Stata file, and we calculated descriptive statistics from other parts of the survey using Stata. The data was transposed from wide to long form and exported to Excel. Each type of exchange is considered a separate network, so we created a worksheet for each type of exchange, and on that worksheet, we made what's called an adjacency matrix, where each of the 16 organizations were listed as both rows and columns. We then exported the data to UCINet, where all other calculations were performed. UCINet is a free software that is easy to use once the data is imported. Within UCINet is the NetDraw program that makes it very easy to draw pictures of the network. It has all the functions you need through simple drop-down menus. However, the software is a bit clunky in that it creates many output files as it performs calculations. You have to be very organized about where you store the files and labeling them so that you can then use them in NetDraw. I'll now share a few key findings from our analysis. In this slide, we summarize findings about the density of different types of exchange networks. As you'll remember from the previous slide, exchange types are listed from left to right in order of increasing intensity. So attending the same activity is on the far left, and signing a memorandum of understanding is on the far right. For each, we calculated the proportion of connections between organizations that were reported out of all the connections that were possible across the 16 organizations. The darker rust-colored bars represent values in 2017, and the lighter orange bars represent values in 2018. As you can see, the level of connectedness among organizations in the LCI coalition increased between 2017 and 2018 for each type of collaboration. The largest increase in collaboration was found for joint planning, a 43% increase, information exchange, a 38% increase, and attending the same activity or event, a 36% increase. As we would expect, the level of connectedness decreases from left to right as the intensity of the form of collaboration increases. So overall, bars slope down from left to right in both 2017 and 2018. We also created pictures to represent connections among coalition members for each type of exchange. This one represents connections between organizations who reported that they jointly planned an activity together in 2017 at the beginning of LCI. We used bigger circles to represent organizations with more connection to other organizations. We used darker brown color to show organizations whose position within the network created more bridges to other organizations. Using the same information shared in the previous bar graph, this picture shows that only 9% of all possible connections based on joint planning were reported in 2017. In 2018, however, this changed substantially, such that 53% of all possible connections based on jointly planning an activity with another LCI coalition member were reported. We see the same pattern for more intense types of exchange too. Here we have a picture of organizations who reported working on a proposal with other LCI organizations in 2017, where only 8% of all possible connections were reported. In 2018, this increased so that 29% of possible connections were reported. These pictures or sociograms were an incredibly powerful way of representing the increased collaboration happening within the coalition over the course of the intervention. This change could not have been represented without our network data. And the pictures were a much more meaningful way of demonstrating this change than a simple bar graph. For the purposes of this presentation, we removed organization names from the pictures, but we shared this information internally with the LCI coalition, and this sparked useful dialogue about why certain organizations were more connected or central than others. For example, one organization focused on building technology skills as a means to support policy advocacy for key populations, and another one focused on media. Even though these were smaller, newer organizations, they were more central and connected to other organizations because of these unique and useful skills for policy advocacy. Sharing the pictures with the coalition members also helped them think about why organizations they might have thought would be connected to certain others were not. This stimulated discussions about facilitators and barriers to connections and a strong coalition. I will say one challenge we experienced, however, was that given that we were studying only 16 organizations in LCI, any missing data had a very important influence. So we had one organization that completed a survey in 2017, but not in 2018 despite repeated efforts, and was also not named by other organizations in the survey. So we couldn't include them in the analysis and subsequent pictures. As another way of measuring characteristics of the coalition and how it might change with the intervention, we included multi-item scales with closed-ended response options, your typical survey questions, and collected and analyzed them like you would any scale. For example, we included a scale to measure perceptions of coalition leadership, but these scales showed almost no change. Here, the mean score was almost identical in 2017 and 2018. The same was true for a scale that measured the coalition's sense of community. There is no change in the mean score between years. This is likely because measures of perceptions and attitudes are less precise, and because the initial scores were high, there was little room for improvement. But by measuring the actual behavior of organizations in relation to collaborations through the organizational network analysis, we were able to see a real change that occurred and that otherwise would have been missed. The point being that without the organizational network analysis, we would have missed these important changes in coalition strengthening. So to summarize, I'll say that adding a network module to the organizational survey required little extra effort in terms of the actual data collection and about the same level of training for interviewers as a typical survey. We did see more complexity in terms of programming the electronic data capture, transformation of the data, and the network analysis, which might require teams to think of hiring someone or having someone on their team with a specific expertise. We saw that strong coalitions are important for policy advocacy, and that that stronger policy advocacy can can manifest from organizational capacity building, and it's important to include a network analysis and endpoint in policy advocacy evaluations. And finally, that pictures of changes in the coalition are powerful representations of intervention effects and can really help coalition members think strategically about how to foster more collaboration. I'll also point you to the Measure Evaluation website, where there's additional information about this network analysis and the overall LCI intervention evaluation. And with that, I'll return the screen, pass it back to Jessica.
Great, thank you, Catherine. So now we see we have a number of questions from folks. We are going to take a minute and organize and look at those, and then come back to you with some responses. So please, when you hear silence, don't panic, we're here.
Well,
wait,
I'm
this
going to,
is
oh, go ahead. Sorry.
Weaver talking. We have a question about how do you determine who is a representative? And I interpret this as who is a representative to answer the survey questions. So in Botswana, what we did was we asked for the facility in charge to refer us to someone who was familiar with the referral documentation and processes that occurred within that facility or service site. And we asked that person. For safe spaces, it was a little bit different. Each safe space had a mentor, and then those mentors all reported to one of 4 or 5 nonprofit organizations, and each nonprofit organization had a point person for referrals. So we interviewed the person who was the point person within each nonprofit organization who was in charge of the referrals. So that was just a process where we asked for the best person and then we tried to contact them. I don't know, Catherine, if you had some different experience with your study.
Sure. So basically the same kind of process where you're thinking about, in your case, it was referrals. For us, we wanted to know who was working together. And so I think like what your question is, what kind of network you're trying to kind of understand and study determines who within the organization is the keeper of knowledge related to that. And so for us, these were smaller organizations. So the executive director or the LCI point person, although that ended up being the executive director in our cases, was who would know like whether or not a proposal was had been written with another organization, if there was an MOU, like what kind of activities the organization was participating or sharing them with others. So for that reason, because of the kind of network and the kind of collaboration we were studying, the ED or executive director was the right person. But I mean, at the end of the day, it's the knowledge bearer for the form of exchange or sharing or interaction that you're studying that you would want to interview.
And we had another question. Can you average responses from multiple individuals within one organization to get a representative view? I haven't done that myself, and I'm not sure exactly how that would work. It seems there would be one source of determinative documentation about whether referrals occurred or not. So for the referral study, I don't think that would be an appropriate method. Catherine, what do you think for your type of outcomes?
I would say the same for completing the network module of these questionnaires where you've got either the name generator section or like the way in which people are interacting, being referred to, or some form of collaboration. Aggregating across people within the organization isn't, I don't know that that would increase precision of the accuracy of those forms of exchange happening or not. I will say that we had survey data from individual CSOs who participated in trainings, and we did look at their aggregate score, created a variable where we looked at their aggregate score on surveys at the individual CSO worker level within those CSOs, and then analyzed that in a different way, but not really in relation to the network analysis per se.
So I see kind of a related question that says, the links you find between organizations can be very dependent on who you interview in a given organization. People within an organization often specialize in different kinds of external relationships with other organizations with limited overlap or redundancy. How do you deal with this issue? We didn't have that issue in the particular study in Botswana, because there was one point person for referrals within each service site, but I could see where if there were limited overlap or redundancy, interviewing more than one person at a service site or organization.
So I see another question here about the use of name generators. Did you impose any constraints on the numbers of organizations a given respondent could mention. And in fact, I think in our survey instrument, we did, I can't remember what our cap might have been, because you can't, if you go on, let's say for like, they name 100 organizations, and then we had a number of follow-up questions. You saw all those different types of exchange. So for every person, every organization that was named, you were then asking them that series of questions for each person they named. I think because of the nature of the network that we were drawing, people did not expand. Like I think we had a maximum of like 19 or so organizations that were named overall. So we really kept it very bounded by that preamble that we used. But if you were doing a larger kind of network, like if it was some form of a closeness network, then you would just practically have to limit how many people they can respond on. And I've seen a number of kind of boundaries used for maybe 5 to 10 people. But I think this probably was very different for you, Emily, given that you were getting all of these different referral services.
Yeah, I think you're right. I'll move on to another question that's specific to the Botswana study. It says, gaps in family planning contraceptive services were presented and certain contraceptive method issues. Was the actual referral pattern to family planning contraception presented, or if not, available? So I guess it is available, and we did see it, although I may not have pointed it out. Here, I can try and share my screen for a minute to show. If you can just give me 1 minute. So this, if you can see the sociogram that I put up, is actual referral connections from safe spaces, and the blue arrows represent multiple services. And those services included referrals that were for both HIV services and contraceptive services. So you would see those referrals that reflect links for those types of services. And the same thing actually for youth-friendly service facilities. We didn't actually see any referrals for contraceptive methods from those youth-friendly service facilities. So either they weren't making referrals for those types of services, or they didn't have documentation for them. So I hope that answers your question.
So I have a few questions specific to the LCI study. There's one on your ONA sample questions. You mixed sex workers and MSM in a single question. How did you ensure in your analysis that you captured specifically information for each category of the key populations? And so this was actually part of the design of the larger LCI intervention, where they had both organizations focused on sex workers and on MSM participating in the coalition. And so we didn't need to because the overall goal of the project was to focus on advocacy for both of these populations together. We didn't need to disaggregate the way we were looking at it. But what was interesting, and why I like this question, is that when we looked at organizations that primarily focused on sex workers versus those who focused on MSM, we thought that we might see them in different places or more connected with each other than across these types of organizations. And we didn't. We actually saw that these organizations were working together a lot on these different forms of exchange. And so that was actually one of the things we were surprised about, to see how integrated they were in their work together. Martha Silva asks about a minimum number of organizations. I'm not sure if there is a minimum. I think that, for us, like, if you want to be able to visualize them, having like at least several where it's kind of useful to see these connections, and that you can't kind of see them without doing this kind of drawing of the sociograms and whatnot, would make sense. Emily, I don't know if you have any suggestions there.
Yeah, I think it just depends on the way that makes sense in your study to define your network. So I would say that's study dependent.
I have a question from Lauren. For the LCI evaluation, can you clarify what is meant by all possible connections? Is that the scenario in which all network members collaborate with all other members in the network? And yes, that is in fact the case. So in theory, everybody could be working with everybody else in each of these ways that we looked at. And so for each of these types of exchange within that, we look to see like, well, out of all of the possible connections that could exist, what proportion was actually reported. So that's what that means.
I have a question about referrals made. Did you only look for referrals made? I am wondering if services received is also possible to look into with this kind of analysis. I think it would be really interesting to look at whether the referral was actually completed. That would be a type of network analysis that you could compare to referrals made versus completed using an organizational network analysis, or referrals within the same facility, say from one ward, from the maternal health ward to the family planning ward, for example. But if you're just considering whether a service is received in a health facility itself, I think a different type of survey instrument would be more suited to that type of question.
This is Ku. I'm one of the panelists with Measure Evaluation, and I was asked to be a part of this webinar to help provide some of the answers as well. I wanted to add to that answer a little bit. I worked on an organizational network analysis in Kenya, where we did ask for the completion of referrals, and that was beneficial in a sense where you can actually see what each organization's perception of, what they were referring, and then where they were receiving clients from. This was also HIV treatment or HIV services related. Our sociogram that we developed after the results was a little bit different in that we were able to actually provide two-way arrows. So some of the facilities that so that they were receiving clients from other facilities, we had a two-way directional arrow to represent that. So there is some, we've done it before. I think that it provides that value.
So I see a question from Emmanuel. What is your experience in using organizational network analysis to facilitate coordination and synergy between implementing partners working on common themes or interventions? And I think that raises a really good point. Even though we were looking at this in relation to an evaluation, really developing these pictures and sharing them with the team that had this end goal of, collaborating towards policy advocacy, kind of really brought to light some assumptions that people might have had about who was working together and who wasn't, who was going to be most central among all of the organizations, and thinking about why that might be the case. And so I really think that did help build coordination and synergy and help them think about how to be more strategic in that, or why some partners might have been having trouble connecting with others in the larger coalition, and suss out some of those issues. In terms of competition and duplication of efforts, I will say that it definitely motivated organizations who might have seen that their role was not being reported as quite as central to kind of think about why and talk to other kind of groups within LCI. So I really think it's in terms of a planning tool that network analysis can be powerful in kind of addressing some assumptions we might have about these connections. And I'll say one last thing to that, sorry, is that the pictures, even though some of the work behind the scenes in creating the pictures themselves are readily digestible, easily interpretable by a wide, audience. And so I really do think they help spark discussion across many different stakeholders. So I see one more question from Lauren. Excuse me. In the LCI study, there was a vast difference between perception of connections and the ONA. What do you think explains this? And so again, for the characteristics that we asked in scale form, multi-item questions, do you agree, do you not agree with certain aspects of the coalition, which included, we looked at leadership, we looked at coalition effectiveness and cohesion, and look to see if that would change during the course of the intervention. And I think, again, because this was measuring attitudes and perceptions, and because the feeling towards the coalition in terms of like their leadership and whether or not they worked well together, which are the standard scales that we found anyway, and how you might measure characteristics of a coalition, were already quite high. So people already had really kind of good senses of the coalition to begin with. But when we got down to the network analysis, it's kind of like measuring the actual behavior versus like an attitude or perception towards the behavior. And I think measuring the actual behavior, we saw that change just like we might if we were studying individuals. So I think rather than measuring perceptions and attitudes about something, it was giving us a clearer picture of like, but how were people actually working together and that behavior. Now, the second part of that question is, do you think this might have something to do with the quality of linkages between organizations? And that's quite possible and relates to one of the other kind of themes in this presentation about like the importance of triangulation. And we did have some qualitative work that helped us understand the sociograms and the connections that we were seeing. So I would say that doing further research and more open-ended work around the networks is really valuable.
Okay, great. Thank you so much, Emily and Ku and Catherine, for answering questions. And my apologies, I did not note at the beginning of the Q&A that we had several other colleagues present for answering questions, Ku Zong being one of them, and also Melissa Markowitz. So thank you to you both for being available for the questions. So thanks, everyone, for joining us today in the midst of what is clearly some global chaos going on right now. We really appreciate your interest and participation. We will send out a link to a recording of this webinar shortly, as well as the slides that were shared. And as always, if you have any questions, feel free to email us and we would be happy to respond. I think we got most of the questions that were asked during this presentation live, but oftentimes things come up afterwards, and we're happy to respond. Thank you so much, and be safe and well, and we hope to see you soon for another webinar.